In my series of Science of Cricket Injuries, today I'll talk about a very common condition which is seen in players, that is groin pain or injuries to the groin. Now when you look at groin pain in cricketers, the most common causes are very minor injuries, like you have adductor muscle pull or adductor tendinitis, you have the trochanter tendinitis, pubic symphysis tendinitis. All these are relatively minor injuries which recover over time with physiotherapy and exercise. My emphasis now is going to be towards a condition which is a very dangerous condition which can lead to permanent damage of the joint and can also be a career ending injury. I am talking about hip impingement or femoroacetabular impingement of the hip. Now what exactly is femoroacetabular impingement of the hip? Let's go back to the anatomy of the hip joint. Now when you have a hip joint, it's basically a ball and a socket joint. That means if you look at the model, you have a ball which moves in a cup or a socket. So this is the basic anatomy of the joint. Now this joint is stabilized by various structures. One of the most important structure is what we call as a labrum. Now labrum is a seal. It's like a seal around, it's a ligament, round ligament around the hip joint. It basically functions as a seal in a vacuum container, or you have a zip pouch. So the zip is actually the labrum. Now when you have an impingement, which can be because of overgrowth of the femur bone or the ball, or the overgrowth of the cup or the acetabulum, when they impinge or when they touch, they usually cause damage to this ring ligament, what we call as the labrum. Now this labrum, if it is damaged, you have instability of the hip, you have pain of the hip, the vacuum effect of the joint is gone, and then this leads to slow damage of the joint cartilage. That damage is called as arthritis. Now it is seen that in long-term studies, when you have impingement of the hip, it results in arthrosis or arthritis of the hip joint. There is a way to prevent